Welcome everyone to this episode of Lifelong Vitality. I'm so glad you're here. I'm your host, Kylene Terhune, and today I have a really awesome guest. Her name is Jessica Drummond, and I'm going to give you a little intro. We're going to be talking about endometriosis primarily today, and she's just an expert in that. So Dr. Jessica Drummond is the CEO of the Integrative Women's Health Institute and author of a brand new book called Outsmart Endometriosis. She holds licenses in physical therapy and clinical nutrition and is a board-certified health coach. She has 20 years of experience working with women with chronic pelvic pain, facilitates educational programs for women's health professionals in more than 60 countries globally, and leads virtual wellness programs for people with endometriosis. Dr. Drummond lives and works with her husband and daughters between Houston, Texas, and Fairfield, Connecticut. So thank you so much for being here. I'm excited to talk with you today.
Thanks so much for having me. Yeah, me too.
So you hop between Texas and Connecticut. So do you work in one place and live in another? Do you work in both places? How does that work?
Yes, well, they're kind of far apart from each other, but my husband was a consultant when I originally started my company about 10 years ago now. And so we moved a lot. We moved like every year for about 13 years. But I was living in Texas when I started my company. I started my company there. I've kept it there. We have our offices there. But it's essentially a virtual telehealth and health education company. And so I live right now in Fairfield, Connecticut, and I've been here for a couple of years most of the time, but we also still have a lot of family and a lot of good friends in Houston. So not only do we go back just to do work-related things, but to see people there. So it's a Houston-based company that's run out of a global, my team is global. We have health coaches in as far away as Australia.
Wow, that's so cool. I love
yeah.
that. That's so neat. So before we kind of jump in, let's start with maybe the basics. Can you explain fundamentally what is endometriosis?
Yes. So endometriosis is a disease process that has a genetic component for sure. It also has an immune and inflammatory and autoimmune components, which the details of which are debated in the literature. But essentially what it is these lesions that are not cancer, but they are similar to cancer in that they are growths. There's various different kinds of them that occur outside of the uterus. So it's a misnomer to think that endometriosis is like a female reproductive organ disease. It's actually by definition outside of the female reproductive organs. Now, sometimes the growths are on the outside of the female reproductive organs, like on the fallopian tubes or on the ovaries or outside of the uterus. But just as often they are on the bowel, in various other parts of the pelvic organs, on the bladder, can be small intestines, can be on the diaphragm or even the lungs, nose, knee. It can be far-flung. So it's a disease that's cancer-like, but not cancerous, and it does increase the risk of women having certain cancers, especially ovarian cancer. It about doubles the risk. The risk is still quite small because ovarian cancer is fairly rare, but it's a little less than double the risk if you have endometriosis, that you're more likely to have ovarian cancer. But it also increases the risk of some other cancers like melanoma, for example. And so to me, that's because of how it changes the immune system, in the sense that, these growths of cells that are similar to the tissue that's like the inside of the lining of the uterus are not like really cleaned up by the immune system in the way that would be ideal, right? And it's similar to that with cancer, as you probably know, that our immune system is supposed to be kind of strategically active all the time and just cleaning up aberrant cells. And so it doesn't really do that with endometriosis, but it also similarly doesn't really do that with cancer. So there's a fair amount of overlap. But endometriosis itself is not life-threatening, but it can be very quality of life-threatening because it leads to a lot of significant symptoms like chronic fatigue, anxiety, significant pelvic pain, painful sex, infertility, bladder pain issues, constipation, SIBO, all kinds of digestive issues, bloating. So it's a very disruptive disease, and not everyone has symptoms. It can actually be silent, but many people, even without extensive disease, do have very severe pain symptoms, especially, that can be problematic.
So it just kind of sounds like if that's something that your body is having to focus on, it takes a lot of energy and attention away from maybe a lot of those other things. And so it kind of trickles down the road into a lot of other problems. I think that's a lot of times what cancer does too. You might not feel it. You might not know that it's there, and it starts growing, and all of a sudden you're experiencing other things that don't seem related, but your body's focusing on what it considers the biggest fire, probably.
Mm-hmm. Sure, absolutely. Yeah, because
Fall by the wayside a little bit.
yeah.
So how did you get into working specifically with chronic pelvic pain and endometriosis and things like that? How did that become your primary focus?
Well, I started my career as a physical therapist a little more than 20 years ago, and I originally planned to go into sports medicine, which I did actually in orthopedics. I was an athlete as a kid. It was a great career for me. But pretty quickly, I began to specialize in women's health related orthopedics, which under the umbrella of physical therapy is kind of women's and pelvic health. So while we're still dealing with musculoskeletal and neuromusculoskeletal kinds of issues, it's more like the shoulder pain related to breast cancer surgery, or the back pain related to pregnancy or postpartum, or bladder incontinence, urinary prolapse, pelvic floor issues. So sort of anything to do with the joints and muscles and nerves of the pelvis. This is you can't be a pelvic floor PT without carrying around a pelvis everywhere. And notice that there's this whole system of layers of muscles at the bottom of the pelvis. Here are your two sitting bones. So there's all these muscles and nerves and circulation and joints. The hips would come from here, that relate to holding up your bladder, having good continence, having, not leaking urine, not being constipated, having pain-free and comfortable sex. All of that is related to a physical therapy kind of component of a certain part of our anatomy. And like I said, sometimes other parts of anatomy, like back pain in pregnancy or shoulder pain after breast cancer surgery. So that was kind of the detour that my career began to take. And then I became more and more specialized in women's health. I worked at a women's specific hospital for many years where, we did everything, worked with women on bed rest and high risk pregnancy, women with clogged milk ducts, women who were in active labor, who were having pelvic pain. I would go and manipulate that. So, but my most challenging patients were patients who were dealing with chronic pelvic pain, which can be very intense, either cyclically or not always aligned with the menstrual cycle. And there were a lot of medical tools and options that people would try, but nothing, sometimes it worked, sometimes it didn't work there. And sometimes the intervention was very invasive, such as like putting nerve stimulators into the spinal cord and things like that. And even that didn't always work. And then what happened to me was my oldest daughter's 16. So when she was born 16 years ago, I had my own kind of health crash. And I think I understand now that I probably had a reactivation of the Epstein-Barr virus, knowing everything I know now, which I didn't know then at all. And I was just sort of given a lot of like antibiotics and antidepressants. And I was getting sicker and sicker and sicker and so debilitated that there were days I couldn't like walk to the bathroom. So I kind of sent myself, we had again moved around a lot during that period, and we landed back in Houston at one point, and I brought myself to the doctor that we used to send all the patients from the women's hospital to, that were sort of our difficult patients, right? I was like, is this person just not presenting how we expect? Are they not doing what we say? Or there's just something we can't understand going on? And she's a wonderful doctor, still in practice. Her name is Dr. Nellie Gross, and she was one of the earliest functional medicine doctors.
Oh, okay.
And I basically lived at her office. Her son is an acupuncturist, and she would see me every couple of months, and she explained. Now, at the time, even we didn't really know that it was related to Epstein-Barr, but we could tell that there was this hormonal crash going on. So she really had me kind of dial back my life and also my personality, which tends to be pretty driven. But of course, at this point, it was easy because I was so debilitated that it was like, whatever you want me to do, I'm like, I'm here. But really, there weren't a ton of complicated tools. I changed my nutrition completely, such that I completely avoided sugar for about 2 years or maybe even longer. I started eating a lot more protein, very little processed carbohydrates, a lot of vegetables. I completely stopped exercising for about 2 years, which was difficult as a physical therapist. And then I really slowly went back to it, like a lot of yin yoga and walking. But 6 months down the road, I was much better. 2 years down the road, I was a lot better. And when I went back to work, I was like, if such simple but really kind of committed to tools could have restored my hormonal health, how could I apply that to my clients with chronic pelvic pain who often have hormonal issues as well? And the thing that was most useful about that was that, I didn't have a lot of, there was not really something sort of in my PT Practice Act about how to specifically apply this. So I was sort of like, okay, try just taking out the most common food sensitivities like dairy, gluten, sugar. And this was back in,
before it was cool.
Yeah, like 2008 or 9 or something like that. And so I was kind of like, what? And I was like, I know this sounds crazy, but and one of my patients who was really at her wit's end, she would do her pelvic pain was a lot better from all the physical therapy interventions, but it would still flare every month right before her period to the point that it was pretty debilitating. And the doctors were like, our only choice here is to do a hysterectomy, which wouldn't have even worked because, as I said, the definition of endo is that it's outside the uterus. But what we've realized with her, I was like, well, she was like, all right, my only other option is to have the surgery. So I'm going to try what you say and let's see what happens. And, months went by and I had actually moved, and she found my cell phone number and she called me and she was like, I stopped eating dairy. I figured out what it was. We lived in Houston, tons of great Mexican food there. And her only Mexican food cravings were right before her period. And that was the only time of the month she would eat dairy, a lot of it, like cheese upon cheese. And her pain would be through the roof. And as soon as she put that together, her pain completely disappeared. And she never had the hysterectomy.
Oh my God. Can we just stop for a second? Yeah. Because people will resist until they're basically on death's door to drop a food that they consider a favorite food. But the changes that it can create in your body are just so worth it every single time. Like that's mind-blowing. That's so easy. If she's in pain every month, just to not eat dairy and to connect those dots, I bet she will never eat it again in her whole entire life. Like that.
Oh yeah. I mean, I doubt she has. That was a really long time ago, but yeah.
Crazy.
Now, I
Yeah.
will put a caveat on that. In endometriosis, it's usually not that
That easy.
simple. However, it does make a difference to start thinking about eating as if you have an autoimmune disease like
Mm.
Hashimoto's.
Just really
Because,
trying to avoid anything that causes inflammation, really.
well, inflammation and stress on the immune system. So a more of an autoimmune response to food, right?
Mm-hmm.
So like people who are sensitive, but maybe not to gluten, but maybe not celiac, for example. Because again, as you know, because you also then have the irritation of the digestive tract that goes along with it.
Mm-hmm.
And we have this additional problem where endometriosis is usually growing as our adhesions on and around the bowel. So that can really change the motility, can really change the gut microbiome, that can really change risk for SIBO. Sometimes there are bowel surgeries that change the ileocecal valve. So bloating and constipation and IBS can be also a part of the disease. So the nutrition is usually not a one-stop solution, because when we put it in combination of two other things. One, skilled excision surgery. So there's one kind of gold standard kind of surgery that goes in and very skillfully takes out the lesions and cleans out the adhesions throughout the abdominopelvic cavity, and of course anywhere else that the endo is growing. That helps a lot. I just saw some new data very recently that taking out those lesions changes the autoimmune response without doing anything else
Wow.
necessarily, which is one of the reasons why fertility tends to increase within the first 6 to 12 months after surgery. Okay.
Wow, that's pretty significant.
Yeah. And so my perspective is, now let's also overlay pre-op and post-op, essentially autoimmune health or immune healthy nutrition, and pelvic and visceral abdominal physical therapy to keep the gut moving well, to keep the pelvic floor muscles relaxed, to improve bladder symptoms. We also have to think about like the urogynecologic microbiome, the vulvovaginal microbiome. And so if you think about all these systems, the digestive system, the immune system, the nervous system, because pain is always a decision made by the brain. It doesn't mean your pain is all in your head. Your pain is 100% real, but it's all in your brain, right? Because you can have the same tissue damage and have different pain responses depending on what else is going on. So the tissue damage, whether it's to your fingers or your skin or your abdominal organs, there are some receptors called nociceptors which give information that like, oh, something is broken here, right? Something's not working correctly. But that's only one piece of the puzzle. Also, how healthy the brain is. Like if it's not full of inflammation, if it's not anemic, if there's plenty of nourishment, plenty of amino acids to build neurotransmitters, the brain is like, okay, there's maybe some problem out of the periphery, but it's not a full system issue. So the pain maybe doesn't have to be so intense, right? It can kind of moderate that. It's not always, the nociceptors aren't also super precise, especially inside the visceral organs. So you might think you have, bloating or constipation, but it might be ovarian pain. It's like, it's hard to pinpoint some of those things. The intensity can be modulated by how fearful someone is of the pain, how constant it is, how much control they feel they have over it. So there are many different factors around pain that we can also influence with nutrition and physical therapy. And then if we combine that with good surgery, and then sometimes there's also a great physical medicine practice that works with pelvic pain that does essentially injections right near some of the tiny nerves and vessels around the pelvic floor. So if the pelvic floor physical therapy, where we're using movement and hands-on therapy to kind of calm and stretch and improve circulation and improve nervous system communication directly in the pelvis and the pelvic floor muscles, if that's not enough, we can get a little more micro, and some of the physical medicine doctors that are very skilled with pelvic injections can also kind of bring down some of that pain in a more specific way. But again, all of that is well supported when you add good nutrition, because that's what's being circulated, all of those great healing, chemistry. As we know, nutrition's not just calories, it's really biochemistry, right? To the places that need it most.
Yeah, that makes so much sense. I feel like when you layer that on in almost any situation that someone is struggling with physically, that whatever it is that you end up needing to do to treat it or to support it, nutrition is always going to help you in that maintenance zone, because your body just needs the building blocks. It needs the tools, it needs the support. And that's where nutrition and mentality and lifestyle really can come in and kind of help you go that extra step to feeling good. So you mentioned that some people can be asymptomatic and still have this, but then other people experience, pretty significant extreme pain fairly regularly, if not constant. So is this something that a lot of people have? Is it fairly frequent? If you don't have symptoms, is it something to be concerned about? Like, what's your thought process there?
So endometriosis is pretty common. It's about 1 in 10 women or people with uteruses. There are transgender men with endometriosis. So, that's 10%. That's very common. It's 176 million people around the world. Yes, so if you don't have symptoms, isn't an issue. Maybe not. It runs in families because of that genetic component. So like if your mother had bad periods and your grandmother and some of your aunts and your sister, it's not necessarily everyone. But if more than one of your female relatives, or at least one, that's where I'm really increasing my level of suspicion. And a lot of times that makes it a little tougher, because you're now born into this family where most of the women had pretty bad periods. I just got my friend Nicole Jardin's Fix Your Period book, which is a different book, but she has this awesome thing on the front that's like, my uterus is trying to kill me, and like mood swings, it's like this whole, and her program is not specific to endometriosis, but there's a lot of overlap. She was also one of our students. So if your mom or your sister or your aunt or your female cousin all are like, oh, this is just part of being a woman, it gets very downplayed. So the diagnosis is often delayed. Now it's not just because of that. It's also because literally gynecologists and urogynecologists are not really educated on this in school. So they don't have a lot of tools. That needs to be improved significantly, but it's about 6 to 12 years to diagnosis. So if you have bad periods, anxiety, fatigue, someone in your family had bad periods or infertility, or even just pelvic pain or sexual pain not aligning with the periods, because it's not always cyclical, the index of suspicion is pretty high because it's so common. If you have absolutely no symptoms, and sometimes people are like, oh, I had symptoms, I just didn't really realize that could be related to endometriosis. If you have truly no symptoms, you may never know unless you have infertility challenges at some point. If there are earlier symptoms, and usually they do start with like digestive symptoms just kind of prior to puberty, or between like 8 and 12 years old, that's sort of the timeline as you start to look back. And then it's like, oh, then I was in middle school and I got my period, and there would be some days where I was like laying on the bathroom floor, just trying to like feel the cool and not pass out, like that intense period pain. My mom was like, oh yeah, get used to that sort of thing, or here's all the Advil, digestive issues that go along with it is very common. But as I said, I also really commonly see fatigue and anxiety, which are related to some of the brain issues in my perspective, but also related to the fact that a lot of times the doctors are like, oh yeah, go on birth control, or, oh really, it can't be that bad, take some more Advil. There's a lot of dismissal of this condition because the frontline practitioners that most people think about going to, the school nurses, the gynecologists, pediatricians, aren't well educated in that. Now, there are people who are trying to change that. It's starting to improve. There's a nonprofit called Endo What that this month in March, actually. If you connect them with your school nurse, who probably right now today, this is not a priority, but hopefully by next March, this will be back to being a priority. They can get some free training on endometriosis, because that would be the great, perfect place to sort of screen for this, would really be pediatricians, school nurses, because if a kid is like missing school, endometriosis is actually the number one reason that middle school and high school girls miss school.
Wow.
Yeah.
Oh, that's so crazy. Oh, that's such a hard time anyway. To not really know what's going on with your body is just a layer on top.
Absolutely.
So, okay. So if it takes a long time to get diagnosed, typically, maybe they've experienced it since middle school and they don't get diagnosed until, late teens, early 20s even. And a lot of physicians, maybe that's not on their radar or that's not their priority. If someone thinks that this might be going on, it might be the cause of their pain, where would you say they should go? What's the first step for them? What would the process be?
Well, I would first go to a gynecologist and talk about it. Certainly our practice is skilled in looking at endometriosis from a more holistic standpoint. So I can give you the links for how people can come and do like just an assessment with myself and or our team to kind of see, like, are you a potential candidate for someone to get a diagnosis? Because the challenge is that unfortunately, the only true way to diagnose endometriosis is by skilled laparoscopic surgery. Now, it sometimes is seen on imaging. So if it's seen on imaging, that's good, then it's there. But if it's not seen on imaging, it's not ruled out. So, so that's a piece of the puzzle, but the true diagnostic is a skilled excision surgery. So, but, we've worked with tens of thousands of patients with endometriosis, and I know a lot of great excision surgeons that we can collaborate with. But, between myself and our team, we can often hear if like this is a picture that's likely to be endometriosis, and then start pointing you in the right direction, and start doing everything you can to get your body in great shape prior to surgery in case that's the next step. We have lots of patients who we see for like 3 to 6 months prior to surgery. Then they go into surgery, have a much better surgical outcome. They're also ideally seeing a pelvic physical therapist before and after. We do now offer some pelvic physical therapy in a telehealth setting, but only in a couple of states. But if we're not in your state, I know pelvic health practitioners, physical therapists all over the world. So we'll help you find somebody. And then post-surgically, it's the same thing. Physical therapy in combination with nutrition will help improve those outcomes.
So how does that differ from maybe the conventional medical approach if someone does get diagnosed? What parts are included and what parts are maybe excluded?
So in conventional medicine, again, usually there's not even sort of a real commitment to diagnosis. It's more just, oh, it sounds like you have endometriosis. Let's try hormonal birth control or some other medication to control the symptoms. There are certain other medications that, for example, completely or pretty significantly suppress estrogen's effects. And some of the lesions are kind of like in breast cancer, are more susceptible to kind of, estrogen can help can make these lesions grow or proliferate. But sometimes it's actually progesterone, sometimes it's neither, sometimes it's both. We now know that the histology of the receptor changes on the lesions are highly variable, but is some cases where estrogen is kind of a driver, similar to the case in some breast cancers. So estrogen suppression therapy, hormonal birth control pills, just pain management, even opioids are prescribed, other pain management, other neuromodulators, antidepressants. So it's really more of like a medical management of the symptoms. And sometimes a real diagnosis is not even pursued.
So in a lot of things like this, it ends up being, because we never know the exact cause, right? We never are able to say, well, this is exactly what happened in your life that made this happen, right? This is why but a lot of times it ends up being sort of a culmination of like body burden and toxicity and things that we're exposed to, and poor nutrition, and just kind of adds up to where something in our body, a gene activates, or we have that poor digestion and it leads to leaky gut, and our immune system starts being activated, and we experience chronic inflammation and pain and things like that. So when somebody is struggling with something like this, how important do you feel like kind of checking off those different areas of your life and kind of making it a goal to, I guess to say it simply, go as toxin free as possible in your life, and to control those things? How much of an impact do you feel like that maybe makes in the long term once they start going down this road?
It makes a significant impact. Now, certainly in some people, it's not going to completely resolve the symptoms. Surgery may be required, but in some people, even though sometimes I still recommend surgery or at least a pursuit of surgery, it's really up to the surgeon to recommend surgery. I pretty much always recommend consulting with a surgeon, because even if we can get your symptoms completely resolved, which sometimes we can, we still, the nutrition and physical therapy is not going to remove the disease per se. So it can still impact fertility. And also potentially increase your risk for cancer, although I would argue that probably is a lot less once we're doing all of those things. In fact, some of the, like pycnogenol, for example, which is an antioxidant supplement made of French pine bark. It's kind of obscure, but even that was looked at in human studies. And not only did it improve the lesions, but it improved the CA125 marker, which is a marker of ovarian cancer risk. So extrapolate that a little bit to a foundation of daily antioxidants in the diet and the culinary herbs and spices, and mindfulness and meditation and optimizing health of the mitochondria systemically, that's not going to hurt, right?
Yeah. That's kind of my mindset. Yeah, do something you can, surround yourself with this. Look, when you're looking at food, just being like, is this information? Is this building blocks for my cells, or is it, maybe something that's going to cause inflammation? It's going to stress my body out. And then just in my life, with everything that's happened in the past several years, and getting into, what I do now, and then going through cancer, if it has the potential to be toxic, to me, there is no safe limit. So we were talking about this recently. I think I was talking to my husband, and it's, things like, for example, glyphosate, right? EWG did that study where in breakfast cereals, it's higher than, what's considered the safe amount for children. And I'm like, here's my perspective on things like toxins in your health. If it has the potential at any level to be toxic, there is no healthy limit, because nobody's measuring that cereal, first of all. And that's not the only toxin that you're going to get exposed to. You're going to get exposed to hundreds over the course of a day or a week, and you can only control your environment. You still are going to get exposed to things outside of your home and around other people. And, you can have these supposed safe amounts, but if you're getting exposed to 100 at a time, you're going over that amount. So to me, there's no safe amount. If it's known, it's out of, I'm trying to avoid it, because you want your body to have the reserves to respond when it's important, and not be constantly reacting to everything around you. So that's kind of my perspective. And I kind of thought that you would respond that way, that it's really impactful. And with the surgery too, it's so interesting when you're comparing them to cancer because, in cancer you have, tumor growths and things like that. And it absolutely can be beneficial, man, if you can go in there and basically debulk or get the tumor out. That takes an incredible amount of stress off your body right away. And then whatever else it is you do, whatever treatment approach you end up taking, making sure you have that lifestyle nutrition to support your body in recovery, to support your immune system to behave appropriately in the future. I think those are all pieces to the puzzle that kind of make the big picture happen. So, yeah.
Absolutely. And I think, in this case, even just exposure to like a lot of plastic water bottles is a challenge. And people find that when you lift that toxic burden of sugar and stress and, environmental toxins, no one is going to get to zero because we just live in a planet that's not super clean.
Not at zero, yeah.
Not at zero. But I think that idea of lowering the load, because inflammation certainly worsens the symptoms. It can certainly worsen the lesions. It can certainly worsen the surgical outcome because then you're dealing with, recovery challenges. The less inflammation you have, the less toxic load you have, the less medication you need, the less strain on the liver, the less strain on your entire, general metabolism and detox system. So to me, that's exactly how we look at it. I've been saying for 10 years, this is our like motto: don't chase symptoms, optimize systems. And so because I sort of lead with nutrition these days, we start with digestion just because that's kind of our conduit, right? And it's not even just everything you eat, but how you're eating. Are you chewing? Are you eating joyfully? Or are you like in the car and like yelling at people?
Go, yeah.
Right. Are you sitting? Are you cooking food? I mean, this entire virus outbreak thing is terrible, essentially in every possible way, except for the fact that here we are at home cooking food. You can't go anywhere. There's not much else to do sometimes. And so, things like this, I think we've lost. Yesterday I taught a class in general just about meal prep for this, and just talked about literally like how to make soup. Like, look around your house.
You did a video on that. Yes. That's right. You can use all of the leftover vegetables you have. You can kind of use whatever you have left over and it'll work.
Yeah. And in our lifetime, at least in our, in most of the US socioeconomic strata right now, there wasn't the need to do what I learned from my grandparents who, know how to make soup. And I was really lucky. I had one grandmother alive, and she just died back in January, and she was 97. So I have a lot of insight, and she was with it the whole time. So I've heard a lot of insight about the last 100 years. And I really think that stepping back and recognizing that we can really kind of downshift and heal all of our systems, give them more resilience. You're never going to make them perfect. We're not perfect beings. We're human, but we can take a lot of our own stress off by doing really simple things that make a dramatic impact on inflammatory markers. I mean, you see in endometriosis, there's a lot of explosion of, increased levels of inflammatory markers in the peritoneum. Symptoms change related to that. Bladder symptoms change, vulvar symptoms change, bowel symptoms change. So improving inflammation, improving digestive function, improving immune function, and improving brain function, because that's where the ultimate decision about pain, also anxiety and fatigue, big factors. There are a lot of brain fog with endometriosis. And again, less need for some really intense medications, which also can strain the system, even though they're valuable to some degree, depending on the person. I think that's really my perspective, is if we can support the whole system foundationally, then all of the other treatments that we use are going to be more effective.
Mm. That's awesome. Well, how can you, where can people buy your book? How can people find you online if you are on social media or have a website? Can you share those resources?
Sure. So our website is Integrative Women's Health Institute. And our the book is available on Amazon. Also, I'm happy to give you a free e-copy of it at outsmartendo.com. And we are most active on Facebook and Instagram. You can follow us on Instagram at Integrative Women's Health. And I do a lot of Facebook Lives. We teach all kinds of little snippets of exciting stuff at the Facebook page, Integrative Women's Health Institute. We also have an endometriosis nutrition free Facebook group. You can go there and we have a lot of tips about different foods that are helpful for endometriosis.
Oh, that's so awesome. And just to make sure people know what the title of the book is, if they want to go to Amazon or Outsmart Endo, it's Outsmart Endometriosis by Dr. Jessica Drummond. Yep.
Here's what it looks like.
I love that. That's so cool. Thank you so much for sharing just everything you've learned over the past 20 years and your passion for helping women in this area. I think we've learned a lot and really appreciate your time.
Thanks so much for having me. It's my pleasure.